Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is what you need to know about facet injections. The facet joints of the spine are about the size of a thumbnail, and you can see them at each level on the left and the right, left, right, all the way from the neck down to the sacrum. These joints do have cartilage, just like the hip, the knee. Together, the joints allow for an incredible range of motion of the spine. They are prone to arthritis, just like other cartilage-bearing joints, and even though they are very small, they can cause an incredible amount of pain. Typically leads to pain in the vicinity of the arthritic joint, and it may radiate into the left or the right, but oftentimes you have several levels that are arthritic at one time. Here you can see an arthritic joint where there's a lot of bony overgrowth and soft tissue overgrowth. The red denotes inflammation. It's actually affecting the adjacent nerve roots. Here you see another shot. See, this facet joint looks incredibly normal, but then you have these areas here with the bony overgrowth. Why are facet injections performed? There's really not a great surgical answer for facet arthritis. These are excellent non-operative options. With facet joints, they can provide pain relief for weeks to months at a time. You can see the needle goes right into the arthritic joint. Facet injections are performed as an outpatient procedure. It only takes about 10 to 20 minutes. Modern pain doctors will use fluoroscopy so that they know exactly where the needle is going and that it's in the joint. Oftentimes they'll inject a little bit of dye to make sure they're in the joint. The skin is numbed along with the soft tissues down to the joint area. And then usually it's some lidocaine or Marcaine, which is numbing medicine, along with some steroid. Several levels can be treated at the same time for convenience, and the procedure can be repeated every few months as necessary. How well do they work? 82% of patients receive pain relief over 50%, and significant functional improvement was also seen at about 80%, and that's with or without steroid for facet injections. The average duration of pain relief is over 3 months, and that's been seen in multiple studies. It's an excellent non-operative method of achieving neck or back pain relief from spinal arthritis. If the pain returns, there are 3 treatment options. 1 is to repeat the facet injection. 2 is to have a medial branch block, which is an injection of numbing medicine and some steroid around the joint, but not into it. Okay, and that blocks the transmission of pain signals from the tiny little nerve endings called the medial branches. Or the person can go on to have a radiofrequency ablation, which is a procedure that heats up this area and deadens those little nerve endings for pretty much like 6 to 18 months. It's incredible pain relief. These are very low-risk injections. There's a slight risk of infection, bleeding, or allergic reaction. The needle does not go into the epidural space. You're not around any nerve roots, so there's a negligible risk of any nerve root or spinal cord injury. The top non-operative pain management in Florida is through the Florida Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 different treatment options with the board-certified award-winning doctors. Visit us online for the Tampa area today at painmanagementtampa.com, and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.